name is Michael Kirk. Some of you may remember me from last year. In 2005, I had a dissecting aortic aneurysm that started in my ascending aorta, and they found it 68 hours after my original injury, or my original time coming to the hospital. I went as a patient with chest pain in my chest, radiating to my shoulder, to my neck, and to my face. I was short of breath, I was sweaty, I couldn't find a position of comfort. And I just figured at 37 years old, it was my time to have a heart attack. Because we thought that my family died of heart disease. My grandfather died at 45 and my mother died at 55. And we just assumed it was heart disease. So I went to the hospital, and the next morning, or that day, the doctor said, we have no idea what's wrong with you. It's not your heart, it's not your lungs. And you're short, you're stumpy, you don't have Marfan's, and you don't have a history of heart disease for yourself. So, it can't be a dissection. And I didn't fit the model at the time for an aortic dissection. So they just tapped me on the shoulder and said, "Are you a nervous person? Do you have anxiety? Because if you do, we'll go ahead and treat you a little different. But we will admit you to the hospital because we really don't know what's wrong with you." The next morning, they chose to do an echocardiogram and a stress test treadmill test. And so they did the echo, and they put me on the treadmill, and I felt awful. And I do have a history of high blood pressure and also gastroesophageal reflux disease, GERD. And so they believed that since my echo looked fine, or semi-normal, which they both asked me if I was a smoker because the picture was fuzzy. They said, well, because you're an ex-smoker and that we can't see very clearly, we'll send you home. Because we've ruled out your heart as some of the things you may have read on our acute aortic syndrome, that my heart enzymes never elevated. So they just said, okay, it's not your heart, go home. If it happens again, drink a big giant glass of warm water. If the pain goes away at your stomach, go see a regular doctor. If it doesn't, come back and see us. So about 6 hours after being discharged from the hospital, I went back to the hospital with horrific chest pain. Felt like somebody was tearing me apart with a fork and a spoon on the inside, and my blood pressure had gone down into, at least on the arm that they're taking the blood pressure, down to about 90/40. And I felt horrific, and I just felt awful. They gave me as much pain medicine as they could, and I still felt bad. But because I was ruled out in the morning of having heart disease, they went, it can't be your heart, it's not your lungs. Are you a nervous person? Do you have anxiety? We'll admit you, but we don't know what's wrong with you, so we'll do some more tests in the morning. And so the next morning, the doc came in and said, well, we really don't know what's wrong with you, and your heart's fine, so we're going to send you home and follow up with your regular doctor. My wife, being the wonderful woman she was, stood up in this doctor's face and said, there's no way in heck I'm taking him home. You can discharge him to anywhere you want, but I won't take him home. So they decided to say, okay, we'll do lab work. So they ruled out the gallbladder, the liver, the pancreas, the kidney. And they said, well, we'll have to do an ultrasound because none of that comes back positive. So they did an ultrasound for the gallbladder, pancreas, liver, kidneys, and spleen. Not the problem. They said, well, we'll do an upper endoscopy. We'll take a look at your stomach and your esophagus to see what's wrong with you. And they said, if that doesn't come back with anything, then I guess we'll have to do a CT. But, you're short, you're stumpy, you don't have Marfan's syndrome, and you have no history of cardiac disease. So you can't have a dissection because you don't feel like the people that we see that have aortic dissections. So they did the upper endoscopy and said, well, everything looks great. And then they put me on the CT table or the scan, and I was very much happy from the drugs that they gave me for my upper endoscopy. And I asked the radiology tech after the procedure when I'm still on the CT table. And I said, so how does it look? And he goes, well, the doctor will be in just a moment to tell you. That can't be a good thing. What I didn't say, at the time that I got sick, I was a cardiac ICU nurse. So I took care of people like us that go through the surgeries post-op. So taking people to the CAT scan in the past, that you can kind of see on the pictures of the CAT scan what looks odd and what may not look so odd. And their eyeballs were about this big around. My cardiologist comes in and says, so you have an idea of what's wrong? And I went, well, do I have a AAA, abdominal aneurysm? And he goes, that's one of your problems. he goes, so for me, I had a type 1 DeBakey dissecting aortic aneurysm, which is right above the heart, involved my ascending aorta, my aortic arch, my left carotid artery, my left subclavian artery, down through my chest, down through my belly, and into the iliac arteries where the aorta splits off at the bottom. And at that time, it was 6.5 centimeters in diameter or so. And I had started leaking. I had begun to have a pericardial effusion, which is fluid and blood around the heart and into both lung areas. And they said, how do you feel about cardiac surgery or open heart surgery? And I went, well, what do I have a choice of? He goes, well, you have a choice of that or you don't have it. So we made the decision to get transferred to another facility because the hospital that I was in did not do open heart surgery. And just for the giggles of it, the doctor said, well, let's check the blood pressure on your other arm, because I had an IV in my right arm and they didn't want to destroy that because it was hard to find IV access on me when I went to the ER the second time. And so on the left arm, it was 86 over 47 or 48, somewhere around there. And the right arm, it was 130 over 80. So the doc goes, wow, that would have been nice to know yesterday. Hello. So they did send me to the other facility, and the cardiac team actually met me at the other facility, and we chose to go to surgery. And end up after the first surgery was 11 hours, and they replaced my aortic valve, which they found in surgery to be a bicuspid aortic valve. And for me, they decided not to take the whole root. They left the coronary vessels attached to a little chunk of the root and attached 2 Dacron grafts in place of the ascending aorta. The original graft they put in they connected everything back together and it fell apart. So they ended up doing 2 grafts back to back, which he said was kind of exciting. And the nurses and doctors were very, very, as they put it, excited during the surgery because they were doing things that they had not done in the past. And unfortunately for me, I bled really bad after surgery because they said I got too cold and I didn't clot. So my surgeon chose to pack my medial spinal space with gauze to form some kind of blood patch within the chest and hope that when I warmed up that I would stop bleeding. And when I stabilized, they take me back and remove the goodies that they left in there. And they left the stuff there on purpose. And so in 2.5 days later, I was stable. They took me back to surgery, opened me back up, took everything out, and went, wow, everything looks great. Let's shut him up and see if he wakes up. And so I ended up being on a ventilator for about 4.5 days, and almost the 6th day, I woke up. And then they took me off the ventilator, and 3 days later, I went home. And basically have been... The parts they fixed and worked, and the parts they fixed worked great. And I am now up here talking to you guys. So all in all, I did have a prosthetic valve placed and the ascending aorta, most of it replaced, but I still do have a chronic dissection that goes from the graft through the arch, through into the the left carotid artery, left subclavian, down through my chest and through my belly. And unfortunately, my aortic arch is still 4.5 centimeters in diameter, which they look at and say haven't changed since surgery, so we'll let it go. So in respect, I kind of like where I am sitting, and I enjoy being here, and I enjoy spreading the message of TAD and VAVD to our communities, and hopefully we'll be able to get more and more information out and diagnose this sooner. And I know that from my case, my cardiologist won't say that he misdiagnosed anything, he just says that he didn't see it. And I understand that from a medical standpoint that he didn't see it. But 4 weeks after I was diagnosed and he treated me, he caught a lady that was having an aortic dissection, an ascending aortic dissection in the ER and sent her to surgery that day. So I choose to believe that him learning with my experience that he skipped some of the things that he would normally do, like admit the lady and then look at her the next day. They scanned her that day in the ER and sent her to surgery within 6 hours.